Hello everyone. Today, we are going to discuss stomach ulcers. Have you ever experienced a burning sensation in your upper abdomen, especially when your stomach is empty? Do you feel temporary relief after eating, but the discomfort returns later? If so, you may be experiencing a stomach ulcer. Now, what is a stomach ulcer? A stomach ulcer is a lesion or open sore that develops in the inner lining of the stomach. The stomach normally produces strong gastric acid to help digest food. At the same time, it has a protective mucosal layer that shields the stomach wall. When this protective barrier becomes weakened, the acid can damage the tissue and result in an ulcer. You can think of it as a small wound inside the stomach that becomes irritated by acid. Now, let's discuss the causes. There are two primary causes of stomach ulcers. The first cause is a bacterial infection known as Helicobacter pylori, or H. pylori. This bacterium disrupts the protective lining and increases vulnerability to acid damage. The second cause is prolonged use of nonsteroidal anti-inflammatory drugs, or NSAIDs, such as ibuprofen and aspirin. These medications reduce the production of protective substances in the stomach lining. Additional risk factors include smoking, excessive alcohol consumption, chronic stress, poor dietary habits. Certain individuals are at higher risk, including older adults, patients who frequently use pain medication, and individuals with unhealthy lifestyles. Now, let's review the symptoms. The most common symptom is a burning or gnawing pain in the upper abdomen. This pain typically occurs when the stomach is empty, between meals, or during the night. The pain may fluctuate and may temporarily improve after eating or taking medication. For example, a patient may wake up at night with abdominal discomfort, consume a small amount of food, feel relief, but later, the pain returns. Other symptoms may include abdominal bloating, nausea, reduced appetite, unintentional weight loss. In more severe cases, patients may experience vomiting of blood or black tarry stools. These are critical warning signs and require immediate medical attention. Now, let's discuss complications. If left untreated, stomach ulcers can lead to serious complications. These include gastrointestinal bleeding, infection, or perforation, which is a hole in the stomach wall. These conditions can be life-threatening and may require emergency intervention. Now, let's talk about diagnosis. Healthcare providers use several methods to diagnose stomach ulcers. First, clinical history. The provider asks about symptoms, dietary habits, and medication use. Second, testing for H. pylori. This can be done through breath tests, blood tests, or stool tests. Third, endoscopy. During this procedure, a flexible tube with a camera is inserted into the stomach. This allows direct visualization of the ulcer. A biopsy or tissue sample may also be taken to rule out infection or abnormal cells. Now, let's discuss treatment. Treatment depends on the underlying cause. If H. pylori infection is present, patients are treated with a combination of antibiotics to eliminate the bacteria. Additionally, doctors prescribe medications to reduce stomach acid. These include proton pump inhibitors, or PPIs, and H2 receptor blockers. These medications promote healing by decreasing acid production. If NSAIDs are contributing to the condition, the medication may be discontinued or replaced. In severe cases, surgical intervention may be required, especially in cases of bleeding or perforation. Now, let's review side effects. Some medications may produce mild side effects. Antibiotics may cause diarrhea, nausea, gastrointestinal discomfort. Acid-suppressing medications may cause headache, mild abdominal pain, or digestive changes. Most side effects are temporary and resolve over time. Patients should follow medical guidance and complete the full course of treatment. Now, let's discuss patient care. Lifestyle modification plays a key role in recovery. Patients should follow a balanced diet, including vegetables, fruits, whole grains, and lean protein. They should avoid foods that irritate the stomach, such as spicy food, fried food, and acidic food. Patients should also avoid smoking, alcohol, and excessive caffeine intake. Eating smaller, more frequent meals, and avoiding late-night eating can help reduce symptoms. Stress management and adequate rest are also important for healing. Now, prevention. To reduce the risk of stomach ulcers, avoid long-term use of NSAIDs unless directed by a healthcare provider. Maintain healthy lifestyle habits and seek medical evaluation early when symptoms appear. Now let's summarize. A stomach ulcer is a common gastrointestinal condition, but it is treatable. It occurs when gastric acid damages the stomach lining, most commonly due to bacterial infection or medication use. Symptoms include burning abdominal pain, nausea, and changes in appetite. If untreated, it can lead to serious complications, including bleeding and perforation. However, with appropriate treatment and healthy lifestyle changes, most patients recover successfully. If you experience symptoms, do not ignore them. Seek medical care early to prevent complications. Thank you for listening.